if I told you that there was relief for your pain that once you rubbed it on, it only takes minutes before you will be relieved of the thing that is ailing you? I'm telling you from experience that it is possible. And I'm telling you that there is a formula, there is a product that is all natural, made with all things grown from the earth, nothing added, nothing that can cause cancer. Just a formula made up of herbs from the earth. Today's guest, Candice, Dr. Candice, my new friend, doctor of acupuncture and Chinese medicine with over 20 years of experience and the founder of the Formula 4, a groundbreaking line of pain relief creams inspired by Chinese medicine. She's joining us today. I want you to prepare yourself. I want you to really tune in. And what I want you to do is take notes if you can. If you have to take the time and go back and re-listen, this episode is worth your while. Tune in. You don't want to miss it. Let's join the conversation. Welcome to another episode of the Haven for Soul Care podcast. I'm your host, Brianna, and today we're joined by Candice. Candice is a acupuncturist. And so today we are joined and we're going to learn some more about some holistic things and all that Candice does. So Candice, I'm going to go ahead and turn it over to you and let you introduce yourself. And we're going to get right into the conversation because me personally, I have a lot of questions.
Good. I'm excited to hear your questions. So I'm Candice Jania. I have my doctorate in acupuncture and Chinese medicine. I've been practicing for about 20 years now, and I practice in Basking Ridge, New Jersey. And about 3 years ago, I started my other company, which is called the Formula 4. And it's based all in Chinese medicine, and it's a line of topical products because, you know, my goal, I think in my life, my mission is to really help people and relieve suffering. And being an acupuncturist and herbalist, I really could only influence people in my geographical sphere, right? My patients that would be able to come to me. And then over COVID, I actually had the idea to make a pain cream because it was, you know, I was combining products and I was trying to figure out the best way to help my patients that were in pain. And I came up with an idea that would combine the best of Chinese medicine with a modern, easy to use cream. And that's when I launched my company, the Formula 4. And I realized I'm like, I can actually reach people across the entire country. So that's kind of what was driving me to do that. And that's what made me excited to move forward with it.
So let me tell you something. So those of you who are listening, I want to tell you something. Candice sent me some samples of her pain cream, and I have had a pain in my wrist for probably 2 weeks. And I'm like, I started stretching. Maybe that's what it was. This, and this. I rubbed that cream on my wrist. When I tell you it is better than icy hot, or I like this, I used to like to use Tiger Balm. When I tell you it's magic, I have tried a lot of products and I'm like, kind of iffy. Yeah, okay. But when I tell you, not even 5 minutes later, I'm all over the place using my wrist and not feeling any pain. Literally not feeling any pain. And as the description says, the smell of it, I can do this all day. Yeah, and it's calming. So,
Yeah.
if you have anxiety, those of you who might have anxiety and pain, you can put that on and sniff that when you're starting to have an episode.
I love that. I haven't heard that. I love that.
Oh my gosh, what I tell you, I was like, because I got the samples and I was like, okay, I'm going to go ahead, I'm going to use it. But then life happened, right? And so yesterday, I was like, let me go get the samples. Let me try them. I'm like, wait a minute. Where have you been all of my life?
Awesome. I'm so happy to hear that. We've heard that a lot, and I'm really proud of my product.
Oh, you should be. You should be.
Thank you. Thank you.
Yeah. So I'm gonna go ahead and let you go ahead and go on because I think that and it's all natural. I'm bragging about you. Like,
yes. And that was actually a really, really important part for me because like I could have, so many people use like preservatives or, to make it into a cream, that a lot of people use these emulsifiers that are not natural and things like that. But it was really hard to get an herbal liniment. So let me explain an herbal liniment first. So thousands of years ago, the Chinese perfected the art of pain management because they had martial artists, they had warriors, they had all of these people that were in pain. So what they do was they take a whole lot of herbs, all different herbs, probably about 10 to 12, sometimes 15 herbs, and they'd throw them in an alcohol and water bath, basically, and they'd let them soak. Once they soaked for a period of time, then they strain it out and they'd apply that liquid to either they'd make it into a balm with oil or they'd put the liquid on and it would help increase circulation, decrease inflammation, and stop pain. And that way their warriors and their martial artists could actually keep moving and working and warrioring, if that's a word. and and every family in China had their own specific herbal formula. So they would all have their own secret formula that they all thought would work the best. So I researched into every single one of the ones that I could get my hands on. And I really tried to come up with the best of all worlds, and really make a base liniment that was going to be applicable for chronic and acute pain. And then after I did that, again, it's really hard to use, right? Some liquid, like what are you supposed to do with a liquid, right? I mean, most people, especially in the United States, is like, what am I going to do with this? I can't like pour it on. I had the idea to make it into a cream, but then add CBD to it as another layer of pain relief. So not only do you have the herbs acting as the pain relief, but then you have CBD. And then I added menthol and camphor, both natural, because a lot of companies actually use synthetic camphor, which is made from turpentine, paint thinner. Okay. And I was like, it's so much more expensive, but it was really important to me to use that natural camphor. Again, keeping with, an all natural product. And then I added ginger oil, cajeput oil, and peppermint oil, which again adds to not only that lovely smell, but also it adds another layer of like warming, cooling, and helping the herbs to penetrate into the skin. And that's why you have this kind of holistic product with these multiple layers of pain relief that a lot of other ones lack. So that's kind of the basic gist of that product.
And I mean, you can really feel it absorbing. I can't even describe, because for someone like me who have been in car accidents and things of that nature, who sometimes during cold weather, pain is there, right? Because arthritis starts setting in.
Yes.
And so I've used topical things and it's like, I can feel it, but you got rub, rub, rub. But yours, I didn't have to do all that rubbing. I put it on and I could start just feeling it start going into my skin. And I'm like, oh, that's different. And, and it just starts working. And I just can't, there's not another word that I can use outside. Like, this is some magic stuff.
Wow. That's amazing. Well, I will definitely be sending you a bottle. I will. No, I appreciate so much like you having me on, and appreciate just how much you really love it. And I will definitely send you a bottle because I know I just sent you the samples. So look out for that.
Yeah. I want everybody to go out here and get it because I don't do this a lot and I get a lot of samples, but I'm like, there's not a lot of, when somebody tells me that their stuff is holistic, I'm like, you can kind of tell, but y'all, I can't brag enough. You can tell your body really does talk to you. And so it will tell you when something isn't good for it. And it is totally good for your body. That's all I can tell you, because your body, if you are in tune with your body does talk to you.
Yes. Oh, I totally believe that. I don't think many people listen though.
Yeah. Like me with food, we still
because it tastes so good going down sometimes. I know your taste buds don't necessarily talk to your stomach, unfortunately.
Yeah, isn't it like, oh, okay. So tell us about, how did you get into being an acupuncture, and then you're a doctor at that, and so what drives you to help people in this holistic way? Because acupuncture is real, and then a lot of people don't know what it is. So if you can explain to the people what that is, so they can really understand, why I consider you an expert in this, not just because you've done the research, but because you have the education behind it as well.
Yes, yes, thank you. So a long time ago, I actually was when I was in my career prior to being an acupuncturist, I actually got migraines almost every single day. And I would, of course, I chose the traditional route. I had many doctors I went to, and they just gave me, all these different pills. And, they just either didn't work or they had side effects, or I just didn't want to take something every day. And my life was getting really difficult. I mean, I was in Grand Central Station and I actually lost vision in half of my right eye. And it was terrifying.
Mhm.
And I was just like, there's got to be something I can do here. And eventually I stumbled upon an article about acupuncture and I'm like, you know what, let me just give it a try. So I found somebody that was local to me and she did acupuncture. She gave me herbs and it changed my life. Changed my life. Like maybe I get a migraine once or twice a year now, maybe three times, but I know why because usually it's my own fault. And I could not believe how different my life had become afterwards. And I just, I feel like because of what you do and what you talk about, like it's just a soul knowing that that was my path. And I called up my mom and I'm like, I know what I want to do. And
Mhm.
I found an acupuncture school that was very close to me in New Jersey. And I quit my job and I started school. And it was, the best decision I've ever made. So, acupuncture, for those of you who don't know, it is basically the insertion of these tiny, tiny, tiny little needles in your body. And I know people are always like terrified. I hate the word needles because they're not really needles. They're like the size of your hair. And basically, what they're doing, if you, I talk about acupuncture in the body. So your body is basically made up of like roads and highways. And when you have pain or something going on in your body, you can think about it as either a car crash or a traffic jam. And what the acupuncture needles do when they're inserted into specific points is they act as the traffic light or the traffic cop, clearing the accident, having the traffic move along. Because when there's a traffic accident, that's when you have pain or, I don't know, digestive issues or sleep issues or whatever it may be. And by unblocking that traffic or what we call chi or energy, it's making it move freely. And
Mhm.
that's when you feel better and that's when everything is better. And, to be honest, when we're doing acupuncture, it's your own body that's doing all the healing. It's not us. We're just like kind of putting the needles in and kind of telling your body what to do, but your body's doing the actual healing. There's no medicine in the needles because people ask me that. And I said, there's no medicine. So it's really cool. So there's no contraindications to it as far as like you can be on a medication or it's great for everybody. We even do it on young ones as long as they can sit there. Sometimes we just do like either a laser for little ones or, it's called Tweena where we manipulate the tissue. But, it really is a great therapy for everybody. And I highly recommend you just either talk to somebody if you're interested, if you have pain or something going on, even just call up your local acupuncturist and just talk to them and say, I'm afraid of needles or whatever, because that's usually the biggest hurdle to getting people into the office. They're like, oh, I don't want to get needles. But I'm like, it's very different. It's not like a hypodermic needle that you're going to a doctor
Mhm.
because they're a solid needle. And of course, they're all sterile and it's very safe. But a doctor's needle is a hollow and cutting. So it's made to either put something in or take something out.
Mhm.
Mine is just so thin, it's meant to go between the tissues. And to be very honest, sometimes you'll feel a little pinch, sometimes you won't even feel it at all. So it really just depends. But usually you'll feel just a little heaviness around the spot, and that's the needle talking to the body. And
Mhm.
that's what acupuncture is.
My friend swears by it because I haven't experienced it myself, but she swears by it because I'm a person who I used to get headaches like you on a
Ah,
daily basis, like every single day. And my friends were so worried about me, they wanted me to go and get MRI, CT, and all of these scans. And I'm like, guys, my headaches come from just change of the weather. My headaches would come just because I woke up this morning. I have
right, right. Yeah, exactly. I trust me, I know.
Yeah, yeah, and it's like, and like you said, want to give you and I would never. I had a whole a whole counter of medicines that my doctors would try to give me, and I'm like, I'm not taking that. I'm not taking nothing every day. I'm just not doing it. So yeah, I started doing magnesium, and that liquid in the liquid form, it helped me. But I don't. I just I don't.
Have you ever tried acupuncture?
No, that's what my friend has been urging me to go and do. So
Well,
I'm
maybe this conversation, I'm hoping, will have you go check it out. It
gonna,
really is amazing if you find the right practitioner. It is incredible.
yeah, I'm gonna try after talking to you and then knowing that you've made this wonderful cream. I'm gonna go. Because does insurance sometimes pay for acupuncture?
They are starting, absolutely. You really have to check with your insurance company, but a
Mhm.
lot of them are definitely starting too because the research is really backing up acupuncture. So I know Medicare started covering for low back pain specifically only,
Mhm.
so they're starting. I mean, that's at least it's a starting point. And then usually when Medicare starts, like it trickles down into like regular insurance. So definitely call your insurance company and see.
Yeah, because I know that my chiropractor, he has someone in there that does it too.
That's cool. Yeah. So even you can have a conversation with them there too and just like talk to them about it and see.
Yeah, that's good. So you're on your path. So you've got your degree. You're working it now, and then you transition over to doing this because you have partners with you, right? Correct.
Yes, correct.
Mhm.
Yep. Yeah. Yeah. So yeah. With my acupuncture practice, you mean, well, so I still have my acupuncture practice. So I still am working like 2 full days a week. But the other, well, pretty much all the time is the formula also. But I do have one of my practitioners, Hannah Sirocco. She's also working with me. So she doesn't do the inside, but she actually does the outside. So she is an expert in the branding. So she does all the packaging and all that marketing and creative side. And she's excellent at that too.
Yeah, because it was beautiful. The packaging, the artwork, the pamphlet, the informational piece that came with it.
Yes. Thank you.
Um, so because we love to support women-owned businesses, and so we just want to, especially what's going on now, we want to make sure that we support women-owned businesses because we just leave it there.
Yes.
We
Thank
want
you.
to,
Yes. Agreed. Yes. Agreed. Absolutely.
yeah. So um, tell us. So I know you got the one for the pain. Oh, the menstrual cramps.
Oh, yes.
Let's talk
Yes.
about the menstrual cramps because I thought about my niece with this. So tell us how the menstrual cramp. So you got one for pain, just pain,
Yes.
and then the menstrual cramps, and then I got one more. So I want you to explain to us all of them, please.
Sure, yes. So the menstrual cramp one was my second one. So part of our specialization, actually, I'm a fellow on the American Board of Oriental Reproductive Medicine. So I specialize in women's health, fertility, pregnancy, menopause, etc., and period pain. So we really do great Chinese medicine at helping women with their cycles and too much bleeding, not enough, a lot of pain. So I wanted to, again, kind of bring Chinese medicine into women's healthcare and do something, again, that's all natural, herbally based. This one does not have CBD. And I think I really wanted it. Like, I know a lot of moms might not want their daughters to have a CBD product. There's still a little bit of a stigma out there about it.
Mhm.
So my cramps cream is a topical that the girls or women can apply to their lower abdomen. I actually have them put it on in their belly button because that's where the thinnest skin is. So it's really easy to absorb the medicine in the belly button. And then, of course, their lower back. And it's been really helpful for so many young ladies and older women going through menstrual cramps because, again, it's like, unfortunately, when you go to the OBGYN, if you tell them you have cramps, well, go on the pill or
Mhm.
take Advil. And that's your only choice. There's no other options, birth control or over the counter NSAIDs. So, I really wanted to, again, give people another option for their families, for their daughters, for themselves, so that they wouldn't be tied to having to go on the pill, having to take like 10 Advil, in a 3 day period because they're in so
Mhm.
much pain. And, young women miss a lot of school because of cramps. And, that's a problem.
Mhm.
We need our girls to stay in school and to learn and not be, curled up in a ball in their bed. And I, again, in a natural way, I really wanted to impact them and empower them to stay in school, to be more, to be able to participate when they have these cramps. It's every month. It's a lot of time to
Yeah.
have to not be able to participate in things. So the cream is, again, based on a herbal liniment, and the herbs change. So they're all women-based herbs. So there's a herb called dangui, there's an herb called motherwort, there's a herb called corydalis. So all of these are very specific to women and women's menstrual issues. And we've actually just now added, funny you mentioned magnesium. I just started adding magnesium in addition to the herbs
Mm-hmm.
to the formula, because magnesium again will help to soften the uterus and the muscle spasming and the cramps.
Really?
Yes.
Magnesium, from what I'm finding out, is something that has a lot of benefits.
Magnesium's amazing.
Oh my gosh. Okay. I love it. And when you talk about missing school, when I was coming up, I missed a lot of school because I had the worst, I mean, the worst cramps I had ever. And funny story, I remember my sister picking me up from school and I'm like crying and I'm bawling up in a knot. And I'm like, I just need to go, please, I want to go. And every other month she was taking me to the hospital because that's just how bad I would feel. I mean, crying. I remember one day she was just like, here, take this pill. Well, it was a pain pill.
Oh no.
Here it is now, walking around like a zombie. And they talked about it until, I mean, I was a grown woman and they would bring the story up of, we gave her a pain pill and she was a zombie the rest of the day.
Yeah. It's like you can't function.
Oh, and I'm like, don't give me that. I don't want that no more. I want the pain
No.
stuff, but I don't want to feel like that. So yes, I mean, my niece misses school. Her mother was going to go pick her up, and it was getting to a point where she was saying, I don't know if she's telling me the truth. And I'm like, no, she's telling the truth. She needs to come home. Go get her, because I was one of those young girls feeling like that. So with let me ask you this, since you sit on the board, before we move on, since you sit on the board and you talked about menopause, can you give us a little bit of education on menopause, if you can, if you don't mind, if you can, because with me, I'm in perimenopause. My sister's in menopause. And so, but the hormones and then the things they try to give us, I'm like, I cannot, I can't. When I first started going into perimenopause, I don't know if that's, I don't know. Anyway, because my doctor was trying to explain it to me, but I felt like I was losing my mind. I was up and down. I mean, crying. Somebody could do the slightest thing, and I took it to like the 1,000 times of what it was, and it was just a mess. I was ruining. I was ruining relationships because I couldn't think, correctly. It was awful. It was an awful time for me. And so, and then my sister, who was normally when I say nice, easygoing, I mean, give you the shirt off her back, her pants, her shoes, her socks, when she's having those mood swings, she is like the meanest person you would ever want them. And I'm like, you're never mean.
Oh
You
yeah.
never have anything, mean to say to people, but she's snappy. And so anyway, what can you tell us about that? And maybe you can give us some advice on what we can do naturally.
Yeah, absolutely. So menopause and perimenopause, I think honestly has upwards of about 100 symptoms associated with it. A lot of women are also, again, they don't realize that a lot of their symptoms are from the hormonal fluctuations that happen around perimenopause and menopause. Now, perimenopause can actually last like 10 years, if you can believe it. I know. So, yeah, so we can see it actually fairly early on with some women, and the range is it's a pretty big swing for a lot of people, and then menopause is technically when you haven't had a period for 1 year. So that's when you're in actual menopause. And a lot of women like skip like 6 months and then they get a period. They're like, oh, I have to start all over again. So, So what I would normally recommend, again, of course, is acupuncture, and and sometimes if it's more severe, Chinese herbal medicine, like internal drinks. So your acupuncturist, if they do herbs, they can also put together an herbal formula that will help. Yeah, that will, and it's a drink. It tastes like dirt, but I'm actually drinking it as we speak. But it can really help just balance so many different things because I mean, there's so many different symptoms like joint pain, emotional dysregulation, like you were talking about. Of course, the night sweats and hot flashes are very typical, but brain fog, and there's so many different things. So even ear itchiness. I know it's like the weirdest thing, but like that's a menopause symptom. Yeah.
I'm like this. It's scratching my ear. Thank
Yeah.
you.
Isn't that crazy? That's a menopause symptom. Like dry, itchy scalp. Like that's a menopause symptom. And a lot of doctors don't even tell you that either. But like, so what happens with Chinese medicine, and the reason why I just fell in love with it also is because so we don't treat menopause like, so if you come in to see us, the way I treat you for menopause or perimenopause is going to be different from everybody else that comes in because you're experiencing it the way you're experiencing it. And we diagnose you through the lens of Chinese medicine. So we look at your symptoms and then we formulate what's called a pattern diagnosis. And that's how we treat you with acupuncture and then treat you with herbs. So every single person will have different points and different herbs within their formula, even though they're going to be treated for the same Western disease, menopause.
Mm-hmm.
Because you're experiencing it differently, your constitution is different, like everything is different. So again, if you do go for acupuncture for your migraines, I would highly recommend that you tell them also about that in your perimenopausal symptoms, because that can also be addressed. And it's funny because my practice, again, started off treating more like period issues and fertility issues and pregnancy. But now that I'm, of course, doing this for 20 years, all of my fertility patients are now coming to me for perimenopause and menopause, and they're all
Mm-hmm.
coming back to me. So I've been treating that a ton. And I'm, of course, going through it myself. I've been treating that a ton. And we just have such great, like I practice actually a couple different styles of acupuncture. And one is called Sa'am acupuncture.
Mm-hmm.
And let me tell you, it's like the coolest thing. Like with these 4-point combinations, I could actually add coolness to your body or heat to your body or moisture or dryness to it's really cool system of acupuncture, and it just like got me so excited to learn it. It's like I've seen like these crazy things with that I thought would only be herbal, like the outcomes, but no, I can actually do this with needles. So it's really cool. So even after all those years, I'm still learning and I still feel like there's so much more for me to learn. And that's why I love this medicine.
Oh my gosh, I love this. Let me ask you about those who are suffering fertility issues.
Yeah.
If they when they come in, because I have a client, she has PCOS. I mean, after much prayer, much prayer, she got pregnant with her first adorable baby.
Yay.
Yeah, but my daughter also suffers from PCOS, and I'm like, we're trying to find different things to help her that are, cause she also, when she was 5, was diagnosed with cancer, and so even then they would try to give her tons and tons of medicine, and I'm like, no, we're gonna find other ways to cope with the pain, and because you're already pumping her with this poison stuff. But and so even now that she's 21, but we still and I still monitor like nope, we're not doing all this medicine. Nope, let's try to find something else. So she's gotten into like healthy eating, which kind of has helped her, but I'm afraid that she calls it calorie deficit. I'm like, I guess it's good because you're eating healthy, but are you getting enough calories? Are you doing it right? So things like that. I'm
Uh-huh.
afraid that if she just all of a sudden says, okay, she's doing good for a year and the next year, and then she gains it all back, I don't want that for her. I really want her to find a way because she doesn't mind exercising. But with PCOS, of course, we know that it's still hard for them to lose the weight. So if you
It's
could just kind of touch on that, if you can, if you don't mind.
Yeah, no, I would love to. I actually know a ton about PCOS. I treat it a lot, and actually know it personally as well because my first son had to be was IVF, and I was diagnosed with PCOS. From what I understand, my PCOS was from the birth control pill. Yeah, so I didn't get a period for 2 years. Isn't that, yeah. So I had to do IVF, but I have my son, and so it was fine. But so with PCOS, the heart of it is the metabolic disorder and the insulin resistance. So you really have to manage that first. So most people with PCOS really strongly suggest like a paleo-ish diet. Okay. So lots of really good quality meat. If you can grass-fed, local, grass-fed's really important. Meats for beef, chicken, any of that doesn't matter as long as it's good quality. Like lots of fruits and vegetables, of course.
Mhm.
But the fat is actually really important. The fat, yeah, and most people don't realize that. So the fat, especially for fertility and hormones. So your cholesterols and saturated fats are the backbone of your estrogens and progesterones and all of your hormones. So having that is important, but especially with PCOS, you have to have a low glycemic diet. You have
So,
to do low carb and low sugar. But in order to do that successfully, you have to increase your good quality fats or you're going to be starving. So that's why that's why I usually recommend like a paleo-ish type diet. And I mean ish because you don't want to be too strict. I usually like good quality dairy, but you also want to do full fat dairy.
really?
Yes. And you want to do grass fed organic. I know it's expensive and it's so hard for me to, say this, but you really want to make sure you get good quality foods, grass fed, and organic because, the other ones are actually, so if you get ground beef that's from like ShopRite and it's from like a factory farm, that's going to be pro-inflammatory. If you get a grass-fed, it's not inflammatory and it's actually really good for you and you're getting the good fats. So again, you want to do your olive oils, coconut oils, whole eggs. Again, if you have like farms near you, never take out the yolk, always do eggs. I actually, and it's funny because before when I was diagnosed with PCOS, I was also vegetarian and eating a boatload of sugar all the time.
Really?
Yes, and I was very low fat because this was, way back when and the low fat, everybody think was low fat, no fat, and we would, it doesn't matter how much sugar you eat as long as it's low fat. Like that was like how I grew up, right? And that's what I did. But I was starving all the time and I was like, why am I so hungry all the time? And then I had PCOS, but so it made me alter my diet like crazy. And I'm still actually, I basically follow a paleo diet. And for most people, though, in order to stick with it, you want to do, well, in the beginning, I think you have to be pretty strict. But in order to continue following it, I always say 80-20 because you have to live your life, right? So sometimes you want to have a piece of cake, and that's okay. As long as the next day you go back to your paleo style diet, right? Your whole food diet, lots and lots of like again, if you cook broccoli or you roast, cauliflower, make sure you're doing it with olive oil or coconut oil or a good quality fat because a lot of those vitamins, so no steaming, right? Because also you're gonna be hungry and it doesn't taste good. Like grass-fed butter, put all that stuff on. Like it's good for you. And people are still so scared of fat because we've just been looking at it the wrong way. Eat like your great grandparents ate, right? And that really should help her in, helping to kind of manage her symptoms and two, hopefully, it could also help her to lose weight easier. So,
Yeah.
because I don't believe in a diet, but I believe in a lifestyle change. And that's
I
what
think it makes it easier when you do things like that because you want to stick to it. It tastes good, right? And then it's just, okay, this is just how I live. And I love that you said grass fed, grass fed, grass fed, because so many people are leaning towards the non-animal. And I'm like, people like me, I like my meat.
yes, me too.
For me and growing up and it made me think about my grandfather who he raised cattle.
Yeah.
And I'm
Wow.
like, daddy raised cattle, and granddaddy ate. When we went down his house, we ate normal. We really did eat off the land. My parents, they were gardeners, so our vegetables came from the garden. Our meat came from granddaddy,
That's
and
amazing.
yeah, and then we would fish every Saturday. We had fish,
That's
so we would go
amazing.
fishing, and so I was like, we were healthy. We didn't have
Yeah.
all the problems then. So grass.
Exactly. And that's, I wish people could all live like that. I mean, I know everybody has their own, it's hard for people, but if you could kind of mimic that, that is the healthiest way to live. You know what's in your vegetables because you're growing them, right? You know how your cattle are raised. I'm sure they're grazing out on the pasture.
Yeah. Yeah.
And that's, I mean, I'm sure that you guys lived an amazing, healthy lifestyle. That's awesome.
We did. I mean, we never had to worry about certain things because it was just there. And I think growing up, I didn't realize it was just there. It was just, and everybody else didn't live like that. I,
Right.
I thought everybody lived like that. But yeah, they literally, granddaddy had land, and we would walk the pastures and just have a good old time. He named the cattle. And I just thought it was normal. I would go to school and I'm like, yeah, I walked with granddaddy. We went to the, pastures and we talked to this one or Molly or he had a bull, and it was just fun times. I just thought it was normal. But then growing up, being an adult, I realized that that is not how everybody lives. And I also realized that and we didn't go out to eat a lot either. My dad might have allowed me to have McDonald's maybe once a month.
Right. Which again is like that 80/20, right? Like, yeah, you can have it on occasion because you're balancing it out all the other days with great food.
Mhm.
So, we can handle little bits of not so great and like live our lives and be a part of life and parties and celebrations, or special occasions like going to McDonald's once a
Yeah.
month,
Yeah.
right? If we're not doing it all the time.
I
So
love it. I love it. Okay, so I don't want to spend too much time on this. But I could keep you here all day long.
that's awesome.
Okay,
So
so tell
great.
us about your next cream.
Yes. So my next cream that I made is the formula for the skin. So again, starting with that liniment that really helps. So we add in herbs that are like healing to the skin and clearing out what we call heat. So anytime you see redness or like a rubor to the skin, that's heat and dryness if you have any dryness. So all the herbs are meant to just heal that skin and clear heat and also stop itching. So there's a couple different herbs in there that help to stop itching. So if you have any skin issues,
Eczema, I saw one.
yes, exactly. Eczema, dry skin, cracked skin, itchy skin, bug bites, like mild burns, things like that. The skin cream will really help it. It also has borage oil, calendula oil, and then three essential oils, lavender, of course, to calm. There's one called benzoin, which is not, nobody really knows that much about it. It's actually a tree resin and it heals tissue. It's like glue almost. So like it helps to like heal cuts and scrapes and, damaged tissue. It's really cool. But the really cool thing is it smells like vanilla. So the scent to this skin cream, I just like every time I use it, I'm like, I want to eat it because you have this like lavender vanilla-ish herby smell and it's just fantastic. Cedarwood Atlas is the other one, which again just helps like to heal the skin. So the combination of the herbs, again, the oils, they're very specific for skin, and then those essential oils all really help to make this a really great product. Like in my clinic, I wash my hands all the time. And I mean, they're red and cracked and like I'm putting this cream on because it's just healing my skin all the time because it's brutal in the winter, you
Yes.
know.
Yeah,
I don't know if you had a chance to smell that cream. I sent you that too,
you
right?
sent me that, and I told my daughter because she has severe eczema, and so and so of course PCOS. She has these pimples that'll come up, and she can't sometimes. So she had gotten some medicine, and long story short, it made her skin dry, made the eczema come. So
Uh,
she, look at my face, eczema's all on my face.
oh,
So I told her this morning I wanted her to start using it to see if it would work, but she's at work, so I'm gonna ask her. But I think it's gonna help her too because when I read the pamphlet that came with it, I didn't tell her this, but she suffers from anxiety, and
oh,
I'm an advocate of smells.
oh.
So I'm like, I bet you she's gonna come and tell me that she is calm. It helped her. And she's probably not even gonna realize I'm not gonna say she's gonna say it that helped her. I think she's probably gonna say, Mom, I was just kind of calm today. Things didn't
Uh,
bother me. She's not.
yeah, let me know.
I will.
That's awesome.
Yeah, I will. Because she had to put it on her face, right? So yeah.
Oh, great. Yeah, I can't wait. And if she can, have her take pictures of like, if before and after to see like if, because sometimes you can't, it's just nice to see the change also. So I think that would be great.
Yeah, I will. I will. Yeah, I'm excited. I like I said, if I didn't try it myself on my own pain, I would have been like, yeah, okay, just but no. When I tell you, those of you who are listening, go tell give the website of where they can go and get it. And where they can, because I visited the website. I've looked around because I wanted to see if it was just these three or if you had more. Because I'm like, let me see what else you.
It's my website is the Formula for it's the Formula FOR.com.
So everybody who suffers, if your mother is suffering, if you yourself is suffering, if your daughter who has cramps, who is calling you every month and you're tired of getting off of work, run out and get this cream for your daughter so that she can use it and you don't have to worry about those phone calls no more. I guarantee, I'm saying it because I've used it. I am a witness that it works 100% today. I'm still I used it yesterday. I hadn't even had to use it today.
Oh, wow.
It's not that, because it felt like my wrist felt like it was just tight. And I think it came from me typing and using my phone all the time. Because here lately I'm on the go. So I'm constantly on my phone because I'm on the go. And so, but I rubbed it, rubbed it, it was gone. And then yesterday I'm helping my cousin decorate her new home. We are got a new house, beautiful home. And so I'm in there decorating, hanging stuff, twisting my arm again, my wrist again with screw driving,
Yeah, yeah.
And so so I'm not just saying this, I'm like really telling you my experience because it's in my dominant arm or wrist that I use all the time. And so I'm literally screwing the screwdriver and not feeling that, because when I say it was painful to the place where I was like, honey, you might have to go get you one of those electric screwdrivers.
Oh,
Because,
yeah, yeah, yeah.
but after I used the cream yesterday morning, I was just in the stuff up, not even having to worry about it.
Oh,
So
wow.
yeah. And they know I don't do this. I do not. So I thank you for your work. I thank you because it is all natural. When I all natural, and I'm a big advocate for all natural again because I have a nephew who is a chemical engineer. So he tells me about all the chemicals. He's like, Auntie, everything. He was like, your furniture has cancer agents in it. He was like, Auntie, you're not going to get away from it. So if you
Wow.
can prevent putting things in your body
Right.
he said you'll be better off.
Wow. Coming from a chemical engineer, that's really cool.
Yeah, yeah, yeah.
I'd listen.
Oh, I do. I listen to him. He's very smart. Now he's a nerd, as
I
you.
can imagine. I love it. Nerds are great.
Yes, thank you. I enjoyed this conversation.
Thank you. This was actually really amazing. I loved talking to you.
Yeah, yeah.
You're great.
Hopefully, if you come up with more stuff, we would love to have you back.
Thank you.
Yes, we would love to have you back. And we probably will bring you back. I'm sure the audience are. I'm going to get someone to inbox me and say, "Hey, can you please bring her back? Because I have questions about this, questions about that." And so I would love if you have time in your schedule, um, to be able to
Anytime.
bring you back, because I would love to really talk more in depth about our health as women,
Yeah.
especially it deals with our reproductive organs and our PCOS and weight gain, menopause, perimenopause, because that's a big topic now that everybody is on, especially within my age group, because I guess we kind of looked at our parents and looked and said, not us. I would not be riding down the road, rolling the window down in the wintertime. That's how I used to look at my mother. And
Right.
I'm
That's right.
with
That's right.
my aunt, and I'm like, no, it's cold. Can you please? And she's like, get up. And I'm like, it's cold. Now
Yeah.
that's me. My daughter's walking in my room. She says, Ma, it is freezing in your room. And I'm like, no, it's not.
I love that. That's great.
Yeah. So I thank you for joining us. We if we have questions, I will, and I hope you don't mind, I will probably try to email you, get them to you. And again, audience, please, 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 let's go and flood the website. The links will be in the description for you to go. If you're listening on your commute to work, on your commute home, if you're cooking and you're listening, go to the descriptions. The links will be up there for you to run. Run. Don't walk. Run. Don't delay. Do it now. to go and get your cream for pain, for your, if you have eczema or redness of the skin. Because if you're like me and you're putting things on your skin trying to find different things for because with perimenopause I've had these little hormonal acne stuff popping up for your skin. Some of the products that I use causes dryness and redness and all of that. Go and get it. If you have pain like me, chronic pain, it works. So run and go and get what it is that you need.
Thank you. Yeah, and
What if relief from pain was just 5 minutes away? Welcome back to Haven for Soul Care, the podcast where we empower women to nurture their bodies, minds, and spirits through meaningful conversations. I'm your host, Brianna, and today I'm sharing something truly life-changing. Picture this: 2 weeks of wrist pain gone in minutes. Like magic. That's exactly what happened when I tried Dr. Candice's all natural pain cream, and I couldn't wait to bring her onto the show to tell you all about it. Dr. Candice is a doctor of acupuncture and Chinese medicine with over 20 years of experience and the founder of the Formula 4, a groundbreaking line of pain relief creams inspired by Chinese medicine. Together, we explore the powerful benefits of holistic remedies, natural solutions for menstrual pain, and how you too can unlock the power of your body to heal itself. Trust me, you don't want to miss this episode. Thank you for joining us on this episode of the Haven for Soul Care. We hope today's conversation has provided you with the encouragement and tools to take care of yourself and embrace the journey ahead. If you enjoyed this episode, please consider subscribing, rating, and sharing it with others who may benefit. Remember, you're not alone on this journey. Take a moment today to nurture your soul. Until next time, take care of yourself and each other.